Good afternoon. My name is John Donahue.
My name is Ryan Orton.
My name is Alexander Hall.
And my name's Harrison Hess.
And today we're going to be talking to you about our literature review regarding instrument-assisted soft tissue mobilization, or as some people call it, Graston or ergon. So Harrison, I don't know if you want to start with the first question regarding
Sure.
our biases.
Yeah, so we're just going to talk a little bit about each of our biases. So for me, I saw a decent amount of soft tissue work along with instrument-assisted soft tissue work in the clinic. I've seen people benefit from it like a pain, and they just report that it feels good, but I think overall my biggest bias is that it doesn't really do anything. It just kind of makes people feel better.
Yeah, and I'm kind of the same way. I've seen it a lot in my outpatient clinic that I worked in, and people just said that they felt better, but I never saw any significant increases in like range of motion or anything.
Yeah, I mean, I'm kind of in the same boat. I've never had it done on me personally. I've only seen it like once or twice in the clinic. My thoughts on it are really, I didn't really know what to think of it coming into it. I don't really know if it works or not, but in my opinion, if it makes people feel better and they like it and it's effective, then why not use it? So.
My bias is a little bit different. Unlike the other three, I've had personal experience with the Graston, and I do feel like it is a benefit to myself, and I have seen it in my time at a clinic as well. I do think that it is net positive for helping patients, but at the same time, I do think that there are other methods that are just as effective.
Yeah, cool. So I don't know if any of you guys want to like highlight some of the articles you found that you thought were like super beneficial or like interesting. I know like the one that I thought was very interesting to start was it was an article by Bush et al. It's titled "Comparison of the Graston Technique with Instrument-Assisted Soft Tissue Mobilization for Increasing Dorsiflexion Range of Motion." I just found that it was interesting that if you put Graston up against just somebody who does manual therapy with an instrument, and you compare that to stretching with ankle dorsiflexion, like they're both the same. Like Graston is no better than using just an instrument as a normal practicing clinician. So I think that's important to note before you think that like you get in like your Graston like kind of like area of thought. So yeah.
I think an article that I was very interested in looking at was instrument-assisted soft tissue massage and cupping, and kind of comparing those two modalities. I think with cupping being another very more modern and popular method compared to Graston and IASTM, both had non-significant results, very similar results, despite that lack of significance, and I think it just kind of shows that there are other methods as well, and I think it really just depends on patient perspective with what the research is showing.
Yeah, I would say the one that probably interested me the most was from Lee et al. And it basically, most of these articles that we found talked about like pain modulation and things like that, like patient perception of it, right? But one of them looked at stroke patients with hyperactive gastrocnemiuses, and when applying instrument-assisted soft tissue, it just showed that they had decreased spasticity in their gastrocs after they used it on the tibialis anterior. So I thought that was cool because there's a different population than normal.
Yeah. I mean, some of the research that I looked at was pretty similar. Most of it was related to range of motion. I didn't really see any research that indicated any kind of strength gains or functional gains. It was mainly just related to some spasticity stuff, but also mostly just increased range of motion. And I think even then, some of the literature was a bit mixed. Some found it significantly a positive effect, some were kind of in between, and I think that's kind of the general thinking on instrument-assisted soft tissue mobilization.
I think to close it out just a little bit, we do have a lot of research, as all of us have our own article that we kind of resonated with on like a level of interest. I think with the more accurate and the more studied and researched articles, it does show less of its significance, and I think that's something really important as well, just looking at the higher quality evidence having less of an impact.
Well, I don't know if that's true though, and the reason why I say that is because I found an article in 2019. They did a systematic review, and they looked at IASTM and a bunch of studies that were used. There were 13 studies that were included, I believe, and it said that there was moderate evidence to support the use of IASTM in injured and uninjured participants for improving range of motion and for improving pain and patient-reported function in injured patients. But it is not, there's conflicted research showing its use for strength. So I think like that's more recent. I think there was another systematic review that was on this from 2016, and that one had 7 articles that showed like little to no effect. So like I think like kind of what Ryan's saying, but like kind of in disagreement, like I think like now we're getting higher quality evidence. It's showing that it like isn't as effective or more effective than anything. But also like if you look at like self-reported outcome measures and like pain, like it is showing a little bit better than other modalities, and that could all just be placebo. But at the end of the day, placebo is effective. So yeah.
Yeah, I think if you see that there is benefit in whichever research you're looking at, it's just really important that you look at how that study was done instead of just looking at if it was significant or not, right? Because there was, like John said, some that really supported it and were high level, and then there was some that were high level that said opposite. So definitely just look at what kind of study you're looking at and how it was completed.
Yeah. All right, so as far as like cost benefit for the modality, I don't know if any of you guys have any specific pointers. I just wanted to say like it doesn't require much space. It's reimbursed just the same as manual therapy would be reimbursed. So if you were already planning on doing manual therapy, there's no change in reimbursement if you were going to do it with an instrument. I think that the time is relatively similar to any other like soft tissue mobilization type of modality. But I think where it really gets into it is like the money and the effectiveness. Like the money, if you want to just get some $20 tool on Amazon that you think will work, I think that that's probably just as good as going and buying a $2,400 Graston kit, you know? And I mean, that's not even with the certification that you need to buy the kit, right?
Yeah.
So I don't know if any of you guys have anything else to say. I mean, in my opinion, I think I would use it simply because I think the cost isn't that great for the benefit it may have with some patients, you know?
I would just say completely anecdotally from what I've seen, it's one of the easiest applicable modalities out there. I mean, it's right up there, I would say, with like heat and ice, with just its application being the easiest. Like for traction, you need a big old machine. And even for some like ultrasound or laser, you need a specific device that can do that. This is something that you can just throw in a bag, and I've seen it used in athletic type sideline activities, but I've also just seen it in clinics. So I think it's a little more useful than some other modalities because you can use it in a variety of so many different settings, and that it's just so easily applied.
Totally.
Yeah, if I can add, I'll basically say the same thing you guys are saying. I think from a time, a effectiveness, reimbursement space, all those, I think it's, very worth it to invest in. When it comes to the money, I personally don't think I would go and invest the Graston or the certain kinds where it costs a lot of money.
Absolutely.
If I can get something that's cheaper and do the same thing. So I think if you take it from that approach, it's beneficial to get and relatively cheap for all of it.
I think I'll probably finish that off a little bit with that key effectiveness and that key benefit, in my opinion, being that placebo that we had all mentioned before. I think that effectiveness of IASTM or Graston with placebo is probably one of the modalities that has a bigger effect or bigger net positive with that placebo effect. And not only that, I think it's a very accessible modality to learn as well, which makes that patient education for pain education so much more valid than like a lot of other studies that may have a harder time explaining that to a patient.
Sure.
Yeah, totally. All right, so given the fact that we described how the research was looking, what kind of setting would you guys recommend this for? Do you consider it like a skilled intervention, or do you think it's something techs can do?
I think I definitely want to say for the clinical setting, I definitely think outpatient sports is definitely one of the biggest ones. I mean, you have a lot of athletes that are going through very different stages of inflammation and fatigue in those muscles from all of those intense workouts. And I think with that range of motion and that pain and placebo effect, I think that's one of the biggest uses that Graston and IASTM are going to be having.
I think that I could see, like Ryan said, I think it's probably mostly used in like outpatient or sports or active population. But like my one study said that I talked about, they used it with stroke patients. So I think it could be beneficial in all, probably more so in like an outpatient or sports setting. But I don't think it should be done by techs or anything. I don't really think any manual therapy should be done by techs, really, right? I think that it is a skilled intervention. There's a reason why we learn it in PT school, right? I think it's something that the PT should do. And we just know how it works a little bit more. Based on the research, I think that it works for some patients, and some people think that it works, so I would apply it if it benefits them.
Yeah, I mean, I do kind of agree with you that it is definitely a more skilled intervention. I think that it is something that you could potentially teach to a tech if you so wanted, but I still think it's a skilled intervention because I think it's important to understand like stages of healing and where a patient's at and what kind of like say surgical precautions they have. I think that's a skilled intervention, but I think that there is some avenue to be able to teach that to somebody, but you would then have to make them skilled at that said intervention. And then what settings to apply, I think you guys nailed it on the head. Wherever it would help somebody with pain, I think is a setting that it could be applied to.
Totally. All right, well, do you guys have anything else to add?
I think we all pretty much agree on the fact that if we have this available to us and it would benefit our patient and it doesn't take us any more effort than other soft tissue things, like we could absolutely try it. If you don't have the facilities to use it, I don't think it's the end of the world either.
Yeah.
It's not something that I would, use your life savings on to get Graston or anything, but that's probably my final remarks.
Well, then let's do it this way. We'll do like a little raise your hand if you agree, all right?
Okay.
So, do you plan on using instrument-assisted soft tissue mobilization in the future? Raise your hand if you do. Cool. If you worked at a clinic that didn't have instrument-assisted soft tissue mobilization tools, would you ask the clinic director to buy some? Raise your hand if you agree.
Yeah.
Sure. Yeah.
Why not?
Yeah, why not?
Would you get Graston certified or Ergo certified?
Absolutely
Raise
not.
your hand.
I truly don't think that cost is worth it. I think just
Yeah.
kind of what we had mentioned before, there are a lot of other tools that we could easily buy off of Amazon, and as long as we have that understanding and that ability to educate our patients, I think that's the key. I think that's a key aspect we need to take away from IASTM.
Yeah, totally.
If I could add one last thing, how would you guys approach a situation if a patient came in and specifically requested some soft tissue mobilization related to instrument assisted?
I think if you have that situation, they probably already have buy-in, and they
Sure.
probably would benefit, even if it is from placebo, because they had the autonomy of bringing this in and saying that they think it would benefit. So if it's available to me, I'll do it, as long as it's not contraindicated.
Sure.
I think to finish that off a little bit too, like even if it's something that they heard from a friend of a friend or they heard from a different clinic and they haven't experienced it, I think we will easily have the tools necessary to give them that positive placebo as well, just kind of instructing them on like how it will benefit them, even with some research, not being all in agreement or all in disagreement. I think having all the tools and all the info that we need to educate them, I think that's going to be the biggest part for making it a successful modality for that patient.
Sure. I definitely agree.
Cool. Well, hey, thank you for watching, and have a good rest of your day.